Welcome. Excited to do this with Blue Cross Blue Shield again. We have Cara Mason, who is our strategic account executive. Do I have that right, Cara?
You got it.
And so she is going to be presenting information just about Blue Cross Blue Shield, how we can do great things with not only their website, but on their app, and just things to pay attention to. If you guys have questions throughout, go ahead and put them in the chat, and we will try and address them as we go along, or hopefully have a little bit of time left over. Oh, I'm sorry, guys. That's my phone. I think it's my phone. Okay. Sorry. That was really weird. So ask questions in the chat. We will address them as we can. And if not, then we'll get back to you. But I am going to just pass it on to Cara, and we will go from there.
Awesome. Thank you, Melissa. Like Melissa said, I am Cara Mason. I am your account executive at Blue Cross and Blue Shield, Nebraska. And thank you for taking time out of your day today. And I just have to say, RJ, I've never had a dried mango, but now that you say you talk about them all the time, I'm going to have to try that because it sounds actually like a healthy snack. So thank you for that. Like Melissa said, we'll go over some good things today. You know, sometimes with your benefit plan, you don't know what you don't know that's out there and available to you. So that's what we want to talk about today. I'm going to cover, how to get the most out of your health plan. It's more than just when you're sick. There's different things out there for you. And so I just want to make sure that you guys are all aware and that you have that information going forward. So like Melissa said, questions, please jot them down as we go here, and then we will go over those at the end. And then there's some fun poll questions as we go too. So let's get started. The agenda, choosing the right care, and we'll talk about your network info as well. We'll talk a little bit about preventative care, the programs and services that are available to you as a Blue Cross and Blue Shield Nebraska member. And then, of course, your online tools through My Nebraska Blue, super important and something that I really love to talk about. And then we'll do those questions. Okay, so let's talk about networks and the provider access that you have with Blue Cross and Blue Shield of Nebraska. Blue Cross offers a broad network of trusted providers across the state of Nebraska so that you as the member get access to quality care where and when you need it. Accessibility and quality to care are what really set Blue Cross and Blue Shield Nebraska apart, not only just in Nebraska, but also nationally. So on these next couple of slides, we'll talk about your particular network that you have with your plan. And we'll also talk about the nationwide network. So your coverage has our network, Blue Network, which is our statewide network here in Nebraska. This includes 99% of Nebraska's doctors and 98% of the non-governmental acute care hospitals in the state. So odds are that the provider you already see and trust is in the network that you have. And staying in that network means lower out-of-pocket costs for you and fewer billing surprises in the end. So next we'll talk about coverage when you're outside of Nebraska. So you and your covered dependents are covered nationwide as well, not just in Nebraska, under the Blue Card program. And the Blue Card program is nationwide access, and this would apply anytime, of course, that you're outside the state of Nebraska. So with the Blue Card program, you have access to more than 2 million providers across the country. This includes 97% of the US hospitals and 83% of the US physicians that are in this network. So all you need is your Blue Cross and Blue Shield of Nebraska member ID card, and you'll have those seamless benefits whenever you're traveling or outside of the state. The benefit of choosing an in-network provider. So let's talk about really what this means. And what it means is that you'll pay the least when you stay in network and you are choosing an in-network provider. And like we talked about, it's kind of hard to get out of that network blue network, and chances are you probably already see an in-network provider. So Blue Cross and Blue Shield of Nebraska works with our providers to make sure that we can keep costs down for you as our members. And then with emergencies, I think everyone always kind of wonders, how is that going to be covered if it's in or out? For emergencies, true emergency care will always be covered at in-network rates, even if the provider isn't in network. So I think really what to keep in mind is just to make sure to check that your provider is in network before scheduling. And we'll talk a little bit more about that as we go here. So finding care when you need it. If you don't already have a provider, it's really quick and doesn't require an account. If you just want to go out there without logging into your MyBlue portal, you just go to nebraskablue.com/doctor finder, and you can search as a guest if you want to. So you can search for in-network doctors, specialists, and facilities when you're out here. You can also use it to locate nearby urgent care centers or emergency rooms, depending on where you're at. If you just want to find a quick facility, you can use it that way too. Just make sure that you always check before scheduling if this is a new provider that you're seeing. And that way you can make sure, like I said, it's in network, and it's the easiest way to avoid any unexpected costs. And again, of course, you can log into your My Nebraska Blue, and that's going to give you more specified results based on your specific plan. And we'll talk a little bit more about that in some future slides as well. So getting the right care at the right place is really important. It's going to save you time and money. So this is always a slide that I like to talk about. It's really important to remember that, of course, you want to go to the ER if it's in a true emergency. That's what it's there for. So make sure you're utilizing the ER if it's an emergency. That we want you to do that. For any non-emergencies, we really want to keep in mind to consider telehealth first. It's really easy. It's going to cost you the least amount of money. And then going up on the slide here, telehealth, then an office visit. Those costs generally rise a little bit from telehealth to a regular office visit. And then of course, urgent care next. And then the ER is going to be the most costly. So we'll talk about this too. Telehealth is really easy. It's going to be the quickest way to get care for those minor issues day and night. So that's always, I would say, your first option if you can. Always good to know your options before you need them. So I think we're going to pause and we're going to do a poll at this time. So poll time. I'm sorry. What are ways you can search for an in-network services? Doctor's education, doctor's name, facilities by type, doctor's specialty, doctor's age, and location.
And put all that apply.
Melissa, I can't see the poll, so you just let me know when you want me to move on.
Okay, well, we've got about even on doctor's name, facilities, doctor specialty, and location. Those would be the four that you would be able to search for. So I think you're good to go on.
Awesome. Did everyone get everything right?
For the most part, yeah, I would say.
Good. Good deal. Awesome. Okay, so preventative care, really important. And I always like to ask the question too, did you know that getting an annual health exam is one of the best things that you can do to protect your health? And I think when people have a personal experience with this, with someone that they know, that has caught something really important just by getting a preventative exam, it really kind of brings it close to home and makes you realize that really it is a very important step to staying healthy. So we're going to cover some examples of preventative care. Annual wellness checkups, cancer screenings, immunizations. These are all examples of preventative care that can catch any issues early. And of course, when they're easier to treat, it makes it easier for you and your health. Most in-network preventative services are covered at no cost to you. So make sure that you get those regular visits. And with those visits, your primary care doctor can really help you stay on the right track to improve your overall wellness. And it can, like I said, of course, lead to those lower healthcare costs in the end as well. There's more information out on the Nebraska Blue website. You can just visit nebraskablue.com/prevent. And this has a lot more information about all the different types of preventative visits that you can do. So over the next several slides, we're going to talk more about the programs and services that are included in your health plan at Blue Cross and Blue Shield of Nebraska. These are extra benefits that are already included in the plan at no additional cost to you as the member. So first, and I already kind of touched on this on the previous slide, you have telehealth services, and telehealth is such an easy, convenient way to be seen for a lot of those, non-urgent, simpler issues that you don't have to go to the urgent care or ER for and sit and wait in the waiting room. It's really easy to use Telescope, which is the telehealth vendor that you have with Blue Cross and Blue Shield of Nebraska. Your average wait time is going to be under 15 minutes. And I think it's even way less than that. I want to say it's maybe under 5 once you're logged into the Telescope system. You're going to have access to board certified physicians and nurses, and those nurses are available around the clock with a 24/7 nurse line that is actually free to call. So make sure you utilize that nurse line for maybe just some questions that you have. If you're not sure where you should go to get care, you can always call that nurse line. They're always available. And I know that they can guide you to where you should go for care if it's not something that you're calling that they can immediately assist you with. So again, you can do these virtual visits from home, from your office. There's no travel, no waiting room. So it's really easy and accessible to you on your MyBlue account when you're logged in. It's right there for you. You just access it through a couple of clicks. And then it's going to ask you some questions, just like if you were to go into a provider and have a visit. It's going to ask you some questions about what you want to be seen for, and then you'll go into a virtual visit with a provider. There's also access to mental and behavioral health support as well through Telescope. I know a lot of the behavioral health visits, sometimes people can wait a few months to even get into a provider in person. So this is a great opportunity to use the virtual visits. You can see a behavioral health provider. It's usually within a week that you're seeing this provider. And then of course, if you like that provider, you can stay with them and continue to do those virtual visits through Telescope. If you have any questions about how to log in to get a telehealth visit, you can just go to your member account at mynebraskablue.com. It just takes you a couple of clicks to click through telehealth, or of course, you can always call the number on the back of your ID card to directly call the telehealth line as well. So we want to talk a little bit about the nurse supported programs that you have available that are free to you as a member. There's so many things that we have access to as Blue Cross members: diabetes management, heart health, weight management, smoking cessation, pain management, and so much more. We have an incredible team of nurses that are available to support you and guide you to better health in any of these types of conditions that you would want assistance and guidance with. I do have the QR code on there. I did test it, so it should work. If you try to scan it, I'll give you a minute to do that now. If any of these programs are something that you would be interested in getting more information and having that guidance and support with one of our nurses, please scan that QR code and get started. If you don't scan it today, you can always access it through your Blue Cross and Blue Shield of Nebraska account online. You're going to download the WellFrame app. That's kind of the messaging system that our nurses use to communicate with you. And you'll get started right from there. So there is a quote up there from a Blue Cross and Blue Shield of Nebraska member. And they said about the program is amazing and has really helped me. It shows in my weight and my improved health markers, blood pressure down, A1C down, HCl up, and triglycerides, LDL down. Plus, I just feel better. And we have so many examples of members that have used our nurse supported programs and just absolutely see so many benefits from it. So make sure if this is of interest to you that you definitely download that today.
And we will have, just to talk a little more in depth about this particular subject, have another Lunch and Learn HR Insights on September 9th with Megan Fry, who is part of the Nurse Care Management Program at Blue Cross Blue Shield. And Megan's going to talk all about it. She always laughs and said she could talk for a whole day about it, but she gets an hour, and she will be joining us on September 9th.
Yeah, definitely join that one. Megan is amazing. She's on our nurse care team, like Melissa just said, and you'll learn a lot from her. And she'll go more in depth on all of these programs too and how we can support you. Another one of the programs that's included in this is the pregnancy care program. So there is additional education, encouragement, and support during pregnancy and after delivery through the nurse supported care program. So you will have a dedicated nurse and they are there for you at any time to answer your questions and to support you through appointments, between appointments, after appointments. They're there for you. So there's additional articles, videos, lots of good resources out there available as well too when you're part of the pregnancy care program. If you want more information on that, there's the websites listed there too, nebraskablue.com/pregnancy. And of course, this is also included in the nurse supported programs that I just had the QR code up for. So if that's something that you're interested in, definitely take advantage of that as well. Diabetes care management. So this is also included in the nurse supported programs. A nurse care manager will work one-on-one with you and help build a customized health plan around your needs. They're there to provide education on diet, exercise, day-to-day management, questions that you have day-to-day, all of that good stuff. So just one more part of the program and how those nurses are there to support you. They're also there to assist on any insurance benefits and coverage. I know with diabetes and supplies, care, all of that needs to be really managed. So they're there to help you understand those benefits as well. Mental well-being support. So this is a very important part of our overall health and a part of your plan with Blue Cross and Blue Shield of Nebraska. So we have support that spans the full range from everyday self-care tips to immediate crisis help. And our nurses are there to partner with you to coordinate any mental and behavioral health care for you or your family. On this slide here, we have the 988 Lifeline. You can call or text that. And also available is that Boys Town 24/7 hotline. That 800 number is there as well. This information is also available on the website listed, nebraskablue.com/mental health. All of it is out there. These are available. The hotline is available around the clock. So please make sure that you have those numbers and share them with your family. Again, this is also on the Blue Cross website too, if you ever need those resources. Blue 365. This is a great one. And I think it's one that a lot of our members don't realize you have for you just being a Blue Cross and Blue Shield of Nebraska member. So this is our exclusive discount program, and it offers you as a member savings across many health and wellness products and services, some gym memberships. So there's a lot of, I'm going to go to the next slide here so you can see some of these leading brands that are included in the Blue 365 program. You'll see there's, and this is not nearly all of the brands, there's over 80 of them. And a lot of these you'll probably recognize, like Fitbit, Garmin, Skechers, Reebok. There's just so many, Beltone for hearing aids, lots of great brands and available discounts out there for you as a member. So if you haven't already gone out to the website to see what's available, what the discounts look like, definitely go out there, take a look at it. It's something that, like I said, once you go out there and see all the discounts, it's kind of cool. And then you're like, oh yeah, I need to go out there and see, you know, before I go buy a new pair of shoes, I need to go see what my discount is through Blue 365. So make sure you go out to nebraskablue.com. You can click on the Blue 365, or you can always just type it into the website, and then it will, you will have to register for it. But once you're registered, which is a very easy process, then you can go out there and see all the discounts available. So we have our next poll.
Excellent.
What
The poll
types
is
of-
launching.
Oh, sorry.
There it is. Perfect.
What types of programs and services does Blue Cross and Blue Shield of Nebraska offer? Mental well-being support, telehealth, sleep studies, pregnancy care, pet insurance, discount programs.
And it's looking like, yep, there's a couple of strong ones here. Mental well-being support at 23%, telehealth at 23% of the responses, pregnancy care at 21%, and discount programs at 23%.
Awesome. Everyone's paying attention because I did not talk about pet insurance. So good job. Perfect.
And sleep studies are covered by Blue Cross Blue Shield, but they aren't a specific program that they have.
Yeah. Okay, let's talk about your online member account. This really is everything you need to manage your health plan. And if you haven't already gone out there to log in, we're going to walk through exactly how to create your account and all of the information that you can access once you're logged in. So your plan is online, and again, it's one place to manage everything. So if you haven't already, we definitely want to get you signed into your account so that you can see all the good information out there for you. You can check your claim status, so it'll show you what the plan paid and what you paid. You can review your benefits, your deductible, any out-of-pocket information that will be out there for you as well. You can find in-network doctors and facilities specific to your plan, like we talked a little bit about earlier. And then there's lots of other tools that are out there as well. Oh, we have another poll.
Launching
Have you
this
signed?
one.
Oh, sorry, go ahead.
There it goes. It is on.
Have you signed up for the My Nebraska Blue portal? Yes or no? Do you have the Nebraska Blue mobile app? Yes or no?
And there is a arrow at the bottom of the poll itself where you can advance to the second one, or you can just respond accordingly. But there's a two questions there, obviously.
And if you
Well,
haven't yet, that's okay. By the end of this, hopefully everyone will go out and get logged in.
We've got a huge number that are on the portal, and not as many on the mobile app, but that's okay. Now we're going to know more about it, and you guys can go down and get it downloaded.
Perfect. Okay. So My Nebraska Blue. So this is your online member account, and we're gonna have some screenshots here that I'm gonna walk through. This is really one secure place for your ID card, claims, benefits. Like we talked about the provider search, all of that is available for you. So we'll go ahead and walk through these screenshots of what it looks like when you're creating your account, and then all the information that's in there for you. So the account setup is really easy. It's just a few steps. So you will need your Blue Cross and Blue Shield of Nebraska member ID to create your account if you haven't already. And you'll see the screen there where it says first time visitor, and you'll click on that create account button. If you don't have your ID number, we can help you with that. It's like I said, it's on your ID card if you have that, or it would have come in a welcome email if you're a new Blue Cross and Blue Shield of Nebraska member. It's on there too. So again, that's where you're going to start. And once you're in there,
Kara,
the
I'm going to
homepage.
ask a
Oh yeah, go
question.
ahead. Yeah.
So when you sign up, do you have access to everybody on your plan?
So as long as you have PHI set up, then you should be able to see everybody's information.
And that means that there is a form that you will want to fill out, or actually you won't fill it out, your dependents who are over the age of, I think it's 19. It might be 18, even though 19 in Nebraska is legal age. You'll need to have them fill it out and sign it, and you'll have access to all their information. And if you need that form, definitely reach out to HR Benefits and we can provide that for you.
Yeah, awesome. I'm glad you brought that up, Melissa, because I think that's one of the biggest questions we hear is, well, why can't I see my other information? So yeah, that's a good tip to remember. So let's talk about what you're going to see when you do get logged into your member account on the home page. So the home screen is going to show you an overview of your plan right away. So you'll see your deductible status and your recent claims. Those will show there for you. And then at the top, on the top navigation, you'll see coverage, claims, and then the contact us. The contact us allows you to send a message into Blue Cross and Blue Shield Nebraska, and you'll usually get a response within 1 to 2 business days, or you can always call the number on your ID card and talk to one of our awesome customer service reps. They are always there to help you. When you scroll down on your homepage, you'll see the rest of your account tools. So there's going to be Message Center that you can read messages. And then you can also set your notification preferences here. So if you're getting paper statements in the mail and you would like them to be all through email or through your portal, you can go paperless, and that's you would just click on that option and then toggle it to paperless, the paperless option. So that's available there as well. And then, like we talked about earlier, you can search here for in-network doctors and facilities, all from this same page. And then your prior authorizations will also appear under action items, which I believe might be on another screenshot. Your digital ID card is always available here. You'll see it circled on the screen. So if you ever need it, you can access it right from your account, and you can download it at any time. And then what I think is cool, and this is why I love our app, which we'll also talk a little bit about, you can add it to your wallet. So if you can't access the app for some reason, but you have it in your wallet, you can just always pull it from there, which is really nice to have. This is also really helpful for any kids away at college, or a spouse that always seems to lose their card or can never find their card. I'm sure all of you know one of those. So it's right there in your account, and you always have it available. And there's the screenshot of your card when you're looking at it in your portal. So the coverage tab, this is where you're going to see what your plan covers and where you stand for the year. So when you're in this tab, you're going to see your benefits and your current plan status. This will allow you to see your deductible and where you're at in real time. And it updates overnight every day. So it's pretty real time. It also provides you your out-of-pocket maximum and all that information about your plan. So this will be useful when you're scheduling care, so that you have an idea of where you're at and what you expect to pay. And then there's a further screenshot of your benefits and your current plan status, where you can see your deductible progress in real time. provides that out-of-pocket max there that you see on the screen. Let's see. I thought I clicked it. Okay. This is another tab that's going to show you your benefits. And additional healthcare support is on there as well, covered services, and your share of costs. So all of this information is in there and available to you. The coverage detail, this view is going to break down your benefits by category. So you can see what's covered and any cost share that will apply. And then you can, this is an easy way for you to kind of check specifics rather than maybe calling in. This will give you some more detail. And of course, if you ever have any questions about what is in your account, don't hesitate to call customer service. That's what they're there for. If anything, if you just need some explanation on what you're seeing, please call in and ask any questions that you have too. And then here's a couple more screenshots on what you're going to see when you're looking at your deductible information. Okay, the claims tab. So this is where you track care you've already received. The claims will show the status of each claim as it processes. So you can see what the plan paid and what you're responsible for. So this is a good place to compare a claim against the bill that you received from your provider. And of course, if something looks off, you can click on that contact us tab at the top, or you can call the number on your ID card as well. Okay, member resources. So these are tools that will help you find care and estimate what it will cost you. Locating a network provider starts right from your account page, and we talked about this earlier as well. You can search for that provider name, you can search by specialty, facility type. All of those are on there when you're trying to find a new provider. And then the results will be filtered to your plan's network when you're logged into your account, which is really nice. So you don't have to wonder if that doctor is in network. It's going to have your plan information already in there when you're logged into your account. The provider results will show you details that you can see here on the screen. So it's going to show, this provider's accepting new patients. It will have their provider's office phone number. It'll show how far away that provider is. It'll give you directions if you want to click on the directions link. It will give you any details about language, what gender that provider is, if they're board certified, any certifications that they have. So this will give you the details on that provider that you're looking for. And then from here, you can go to the cost estimator. And this is going to show you what the care is likely to cost you. The estimates will be based on your plan and where you are in your deductible. So you can search by procedure or service to compare your options. And then this is further into estimating your costs. This is a screenshot of looking up what a knee replacement would cost. So this can show you the same service and what that's going to look like based on location. And I think there's another slide here. Yep. So this shows you the dollar amount and the detail. You can click on it and it will show you the estimate for you. So you can see there on this screen, the different providers, estimated out-of-pocket costs, average total cost, and it will show that based on those providers. And then this is a detailed estimate screen. So this view kind of brings it all together. You can see the expected total and your portion before you commit to that provider and that service. So this is a great resource for you. Make sure you can use this estimator anytime that you have care planned and you want to see, what that's going to look like for you and the amount you're going to expect to pay and what your coverage with Blue Cross and Blue Shield Nebraska will pay. So a great resource out there for you when you know you have care that's going to be scheduled. Okay, I think we have a poll next again.
There it is.
Where are places you can get a new ID card? Nebraska Blue mobile app, My Nebraska Blue website, doctor's office, or the Blue Cross Blue Shield customer service line.
All right. The results are coming in. It looks like my Nebraska Blue websites at the top response at 37% of responses, and then Nebraska Blue mobile app, and then BCBS customer service line is the third response there.
Perfect. Yep. All of those are available options. Your doctor's office is not going to have your ID card, so that would not be the correct answer. Good job.
And we had no one answer that. So
Yay. Okay, so let's talk about the Nebraska Blue mobile app. And this is my favorite. We did just revamp the app. I think it's going on almost a year ago now. So a lot of members, I think, still had the old app downloaded. So make sure you have the new and improved app downloaded on your phone. It's so much easier to use than what we had before, and it gives you so much more information. So your digital ID card is on there, like we talked about, and you can add it to your wallet. What's really cool is that it'll flip it from forward to back. So your provider's office will have all the information that they need from your card right from your app. So if you don't have your card with you and you have your phone, you have your device, you'll be able to show them your ID card. One of my favorite things is that when you're in the new app, you probably can't see it because it's really small, but on that bottom little bar there, you see home, claims, doctor finder, messages, and more. If you click on that more button, a little menu is going to pop up on the app, and your telehealth option is right there. That's one of my favorite features because it's just a couple clicks away. So really convenient to have that there. And then actually we continue to add more features to the app. One of the things that we are adding as well is Bennett, which is our AI bot. So we've been doing a lot of testing and having members ask questions to make sure that it's giving, correct responses. But that's really cool that we're adding those types of features. We just want to make things more convenient for you as the member so that you always have your questions answered. So if you haven't already downloaded the new app, make sure you do. All your information's out there. Again, if you have college kids, this is something that they would want to download too, so that they have access to, their ID card and their benefits as well. So with that, hopefully, like I said, after all of this and after talking about it, everyone will have it downloaded after this. And I think that is the end of our presentation. I just want to remind everyone that, whether it's choosing the right care setting, taking advantage of those preventative visits that you have at no cost to you, managing everything from your phone, the tools are there for you. So make sure that you have those tools available. And of course, if you ever have any questions, the team is there. They're available. They want you to call and ask those questions. We have, in my opinion, we have the best customer service team. They are awesome. So if you ever have any questions, don't hesitate to call. That's what we're here for. So that is all I have today. Thank you so much for having me and for taking time out of your day. And I don't know if there's any questions that were typed in, but we can definitely go through any.
No, we didn't get any chat questions. Does anybody have anything before we pass it back over to RJ? Question about dental. That is through Emeritus, so that will be something you can either contact, why don't you contact HR benefits? Anybody else? Okay, RJ, why don't you just take it from here? Oh, doctors in the Virgin Islands. Hold on one second. One more question. I'm going to kind of maybe direct that to you, Cara. I don't know if that is considered an international, the
Did you
US
say Virgin Islands?
Uh-huh.
You're testing me on that one. I believe it is international, isn't it?
That would be my guess.
Yeah.
You
Um,
do have international coverage. I can't remember what the name of it is.
GeoBlue is international coverage. That's also out on our website if you want more information on that. I don't have that exact. If you go to nebraskablue.com and just type in the upper right-hand search area, GeoBlue or international coverage, it'll pull up the information for you. And there's really easy plans out there. I would highly recommend having one of those plans. They're very inexpensive and it's so worth the peace of mind to get those little policies before you go out of the country. So yes, that is available out there. Definitely go search for that. Yeah.
And if you don't get a Geo Blue plan, I believe you can actually get care. You would have to pay out of pocket for it and then submit the claim when you get back. The providers internationally would be considered out of network though, but you can submit claims.
Yes. Yeah. Thank you for clarifying that, Melissa.
Anything else? Okay. It's all yours, RJ.